Well, welcome back to my morning coffee with Tanya G and Sarita, and we are bringing to you this morning a pretty awesome young guy, Walter Watts Jr. the fourth.
Yes, how you guys doing?
Good, and
Good
we want
morning.
to. I'm not going to give you too much about him because in his story, he'll be able to explain a whole lot. But he came out here from Fresno today, but he's from San Jose, California,
A little bit of a
and
Little bit.
he's a legacy. So I want him to go ahead and introduce himself, what he's doing, and why he's here.
All right. Well, again, my name is Walter Watts, and I started something called the SWAM Challenge. No, it's not swimming, not at all. SWAM actually stands for Started with a Mile. And what I'm trying to educate people to do is be a little bit more mindful about setting goals and being consistent and having more control over your mindset. And what comes with that is mental awareness and health, because I think the more that you have knowledge of yourself and how to motivate yourself, you have more control of your mental state. The SWAM Challenge started with actually my mother and father passing away, so I was more in a depressed state when I started the SWAM Challenge. My father passed, unfortunately, from a heart attack from out of nowhere, and my mother passed from brain cancer shortly after. So in that time of kind of heartbreak and confusion and being lost, when my mom passed, I was overweight, I was depressed, and I was like, you know what, let me go outside and go run a mile. And in that process, Started with the Mile was created because while I ran that 1 mile, I felt like I had an epiphany of like, hey, you should start to challenge yourself and start to challenge your family on being a little bit more active and being more educational of what you eat and what you put in your body. So with just me starting 1 mile, I said, hey, let me set a goal to do it for 30 days straight and see what that gets me. Okay. And then after that 1 mile that I did, I was like, you know what? I need to start doing this and start motivating people to set small, tangible goals and be able to strengthen your mindset. So that is really how the SWAM Challenge started.
So listen, I want you to tell the people who they need to understand that you come from a background of athletics.
Okay.
I think it's important to know that depression can happen to anybody.
Absolutely.
Becoming overweight, that can happen to anybody. And even those that know what physical fitness and wellness means to the body, right? So you've been an elite athlete. Your dad's been an elite athlete. Give us a little bit more background about your family history, and then how you got to a place where you were an elite athlete, and then you recognize, man, I've got to this place where I need to change.
Yeah. So my father, he played, my dad was the real deal. He played baseball, he played basketball, he played football, and made it pro in every single sport. So athletics has been part of my family my whole entire life. My grandpa played basketball. It's just, my dad would always say it's in our blood. So we were bred around them. All my little brothers played. My sister played at the University of Colorado. I played football at the University of Utah. Shout out to my Utes out there. And so we've been bred over being competitive and having that brand of we have to get better, we have to motivate ourselves, and it's always striving for greatness. Regardless if you are great or not, we are always still to just, hey, you be the best you that you can be. So sports has always been part of our family. And so yeah, it's just second nature. So the fact that I came from a point where I was playing football and at working out, and I've always been big. Like, I've never been small. I think if I lose too much weight, I would just have a small body and a big old head. So I always say all the
We
time,
can't afford that. No,
yeah, just a big head and a small body, it'll look bad. So
I'm gonna drink some coffee.
I'm glad you know yourself, Walt.
yeah, so I'm not trying to get too small.
On that note,
Right. I'm glad you know
On
yourself.
that note, yeah, I'm gonna have some coffee.
So it was unfortunate just to see my mindset of me being competitive and working out all the time to a point where I was just not doing anything and just lost and gaining weight. So it was really a mental adjustment that I wasn't sure of myself. You know what I mean? Not only just with my family and everyone passing, but the fact that Like I just wasn't doing anything. I wasn't working out. I wasn't doing anything. And with both of those off, I was off and I was lost.
Do you know how you moved from a space of being a competitive and elite athlete to then
Nothingness.
taking the journey to being depressed and not doing anything? Like, can you talk a little bit about that journey?
Because I've seen after college, when it comes to sports, it doesn't have to be football, it doesn't have to be anything. After sports, a lot of athletes don't know what they want to do after that.
Yeah.
So a lot of people are lost in that in between of them maybe thinking they were going to go pro, or hey, this was my game plan, and it doesn't go that way. So it's easy to get lost in the sauce right there. And again, that's why I think mental health is so important, that people need to understand themselves a little bit, because if we understand our basis of what we need, you won't get lost. And if you put all your marbles into one basket and that basket falls at the bottom, again, you have to pick up all your pieces. So to answer your question, how you can lose yourself is just not having a game plan. I think I talk about sports all the time because I think sports comes into life when
It mirrors life.
it
often.
really does. And I talk about having a game plan, working on it as a team, and then having a set goal of kind of what you want. And sometimes when that goal falls apart and you don't have a plan B, you can get lost and you have to try to find yourself. And fortunately for myself, I was so down that I use that as a little bit of a motivation to say, hey, look, this is be the reason why I build back and become a better me.
Was someone able to see it and articulate to you that, oh, maybe you're moving in, or we're seeing a change in you? Like, were there people in your life that?
A change when I was depressed?
Yeah.
No, because not that they saw it in me, because I think as a man, most men don't go out there and ask for help.
Absolutely.
Even with me being a pharmaceutical rep, when I'm talking to a doctor about, hey, here are the symptoms that you need to find, and these are the things that you need to see, their response is like, oh, well, most men don't tell me that these are the symptoms that they see. It would be more of the females that'll tell and express their emotions. So to answer your question, no, I didn't, because I felt that I could do it on my own. Like, oh, I got this. Eventually this will pass. And I think as men, black men or any men, that we kind of put it on our own shoulders, and then eventually it gets too heavy and we crumble. So I think no one really saw it. I could just see myself changing. I'm high spirited. I'm always smiling. You'll never not see me singing or something. And that changed a little bit. And I saw it.
So it was. You can't say it was one particular thing that happened in your life that brought on the depression. It just came on over time. You started showing symptoms of being depressed, and your behavior started to change, i.e., not working out. You started to gain weight and things like that. So since you say you recognize that in yourself, and then I understand that you also are a pharmaceutical sales rep. So now your job is you go out and you're talking to doctors about different types of drugs.
Right.
And what kind of drugs are you talking to doctors about? What your company? What kind of drugs are they selling?
Yep. So I'm a pharmaceutical rep, and I talk to doctors about bipolar disorder, schizophrenia, and depression. So I go into the realm of, here are the symptoms that you have to look out for, because you may not have a patient that's going to openly just come out and tell you. So a lot of times you have to, as a psychiatrist, you have to have a patient that has somebody with them, because the psychiatrist kind of has to go to the person that's with them to say, hey, look, is this what's really going on?
Okay.
Or is he having manic symptoms on the low? Most people, when it comes to bipolar disorder, they think that mania is walking around naked, screaming, and going crazy. But really, it could be just they're really sexually active. They spend a lot of money when they don't need to. They have racing thoughts at night. They can't sleep. It's those little small things that you have to pay attention to.
And that nobody pays attention to.
No one pays attention
because
to.
I hear that a lot, I think, in our community, that about what comes to bipolar and different mental illnesses, we don't really know the signs or symptoms and stuff,
Right.
and things are people are experiencing it every day. But people are used to, I guess, what they see on TV. They think when somebody says, "Oh, they're suffering from mental illness," somebody's going to be, like you said, walking down
They're
the street,
looking for the
looking
extreme.
crazy
Right.
and stuff like
It
that.
has to
But
be
in
extreme.
actuality,
Right.
it's not really like that. It's like people are functioning, but are still have those illnesses.
Right.
You know.
And the hard part is most people think that their mania is them normal. Like they feel on top of the world. Like, yeah, this last ask me what I did this weekend. I wrote a book. I ran a marathon. I fed the homeless. Like it sounds awesome, but it's just to the extreme, and they feel great. So then a lot of people feel depressed when they're normal,
And I
and
think,
that's the hard part.
and also to go along with that is for mania, people get a lot of stuff done
Right.
in their manic state, so it's highly productive.
You're right.
And when you have such productivity, you tend to think that it's a beautiful thing
would I
that you're.
stop that?
Why would I want it to be any different? But the flip side is the depressive symptoms that
Exactly.
kind of take away all of the progress that your mania allowed you to be in. And with clients, I often say, your mania can be, use it when you're in it. It's fine. And also take a look and be on the lookout for when your depressive symptoms
Right.
are creeping up, because it will undermine all of what your mania has worked for.
Absolutely.
Can you talk a little bit about, because I think you make a really good point in terms of the way that people look at bipolar, and I don't think that people really understand the differences between something like depression and bipolar. So I'm interested from a pharmaceutical and educational perspective. Can you talk a little bit about the differences?
And yeah, it's real small, and that's what makes it difficult because now we're going into a realm of bipolar depression as well. So there's depression, bipolar depression, and then there's just bipolar 1 disorder.
Yes.
And when you're depressed, you have people know when they're depressed.
Yeah.
But then when you say like, "Oh, I think I'm bipolar depressed," if you look at the DSM-5 criteria, it's exactly the same criteria.
Okay.
So then how do you differentiate if someone is just depressed or bipolar depressed? And the way most doctors find out is that they'll give a bipolar depressed patient an SSRI, which is a selective serotonin reuptake inhibitor, but then they'll have more manic symptoms. So it's only by trial and failure that patients are getting diagnosed. So if you go by the clinical DSM-5 criteria, depression and bipolar depression is exactly the same symptoms, which is crazy. Because then how do you differentiate?
Yeah.
Who needs dopamine, which is dopamine is your antipsychotic that a bipolar depressed patient would get. But there's no like clean cut way to describe it. So that's the scary part.
Is that where the clinical psychologists come in to play more, and the psychiatrists? Because I work with the mental ill in my profession, and I meet every day with mental health professionals, and we talk about the different inmates that are incarcerated that suffering from mental illness, and there's all kind of drugs that we're not deputies, but they're being administered in the system because of their mental illness and stuff. And you always hear the term, well, whether she got her shot, but she's still acting out, and stuff. And then they'll say, well, we're still trying to figure out what dosage to give her and things like that. Does that come into play a lot? When you say the symptoms are the same, and they're prescribing the same medications for the same things, how do you figure out which is which?
They still have those symptoms. That's the only way that you figure it out.
Okay.
And especially in the prison system or just when it comes to Medi-Cal, a lot of times they're going to give you the cheapest option anyway. So you kind of have to go through the run-of-the-mill of, hey, let's try this, let's try that. But there's a study that came out, the STAR-D study, which is the largest study when it comes to depression, is that by the third antipsychotic, I think patients have about 30% remission, chances of remission, only 30%, maybe 20 after the third medication. And most bipolar or schizophrenics, they're going to try at least 7 or 8.
Yeah.
Wow.
So if they're getting switched and things like that, like the chances are just getting smaller and smaller.
Yeah.
So that's why when you talk about the DSM-5 criteria of it not being different, like the chances of patients actually getting back to remission is slim.
And I want to speak on or ask about that, because how do you support doctors and psychiatrists? Because not everyone has a psychiatrist. Right. Most people go to their general practitioner for their psychotropic medication, which isn't their specialty, isn't the doctor's specialty. Right. So there's already a disenfranchisement that can happen with that. How do you support, whether it's psychiatrists or general practitioners, in keeping the integrity of prescribing? And this is something that's super near and dear to me, but how do you keep the integrity and not just push medication?
The SWAM challenge and working out.
Okay.
Exactly what it is, because when it comes to, if you just keep it bare basics of depression, by all that, you're talking about serotonin, dopamine, and norepinephrine.
All the things that we all have already.
And for example, here's a quick example. If you go out to the homeless shelter or whatever, right, you'll see you'll see people that are in sweaters and it's 110 degrees outside. Yeah. Mm-hmm. Those are symptoms of schizophrenia or bipolar. They're just off. Mm-hmm. They need dopamine in their receptors to be hit. But a lot of doctors will give them Seroquel, and Seroquel will stop they'll block it. They'll block the dopamine receptor.
Mm-hmm. It'll block the dopamine.
It'll block the dopamine. So
and maybe what we should do is, if we can kind of support our listeners, because I'm like all in with you. Yeah. But also these are languages that I think scares people and keeps them from understanding fully what we're talking about. And because saying things like dopamine, norepinephrine, like those are terms that we use commonly in the field, but don't really know. Yeah. So let's have a conversation.
Yeah. So to keep it simple, so coffee, it has norepinephrine in it, and that is basically, it hits the same receptors as norepinephrine. So,
and what are receptors?
Okay. So there's, I wish I had a visual. So there's neurons in your brain, right? And your neurons will shoot off receptor sites to the other cell. Mm-hmm. And by keeping it simple, I'm trying to keep it simple.
And if you need help, just let me know.
Yes, we have a resident therapist here.
Yeah, because I'll go too much.
Right. So our minds fire, and they send messages to each part of our brain. And sometimes when you have challenges with mental wellness, those brain messages don't get sent correctly. And so then there becomes a block. And those blocks create symptoms or signs of something is wrong, because our minds aren't able to fire at its optimal level.
Perfect. So that's brilliant. So to be able to simplify it is the hard part, because I can talk about it bonds to the neurotransmitter and then it's going to shoot off. I can go really deep. So that's perfect. And what people lack to understand is all it is just a neuronal imbalance. So someone might have less serotonin than that they need.
So a chemical imbalance.
A chemical imbalance. It's really that simple. So to label you, you're bipolar or you're depressed, it sounds taboo. It sounds bad to talk about. But really, all you're just not firing and getting the serotonin that you need. It's really that simple.
So it's just saying you need a little help.
You just need a little help.
And it's just like some people that have bad skin. Yeah. They need to have a little help with right. So I
think before
go ahead.
Actually, I think we should keep them here until we close out. But I want to hear more about the SWAM challenge and how you are extending it. How are you growing the program? How can our viewers be involved? Because that's what they want to know.
Absolutely.
Give the people what they want.
I give you what you need. So to even go back off of what you said is like, how do you stop just pushing medicine?
Especially to our communities.
Because I think...
Do you know that 1 in 6 Americans are on some form of psychotropic medication?
I did not know that.
I didn't know.
Wow, I didn't know that either. Viewers, did you know that?
Yeah.
That's good knowledge to know. Because a lot of times all we need to do is exercise. I swear, and I can promise to you, that a lot of times exercise is not going to cure anything. But
neither is medication.
And medication won't either. But just like medication and just like exercise, it will help in this process. Mm-hmm. And I think by having a strong mindset and being clear of just goal setting. So you talking about that you don't like to talk in front of people or be around people with crowds. Like, I don't like being in crowds. But setting a small goal, a tangible goal, like once a week, like, hey, you know what? Every week I'm going to try to meet somebody new. Being able to accomplish that is crazy. I know you don't want to do it, but if that's something that you need,
while we were doing good, we were doing good.
But that's the stuff that you have to do to challenge yourself.
Yes,
you know what I'm saying. And just like taking medication is a challenge, you have to go talk to someone. You have to be comfortable doing all that. That's a challenge for people. Walking a mile around the block is not that hard if you can walk. You know what I mean? And if you can't walk, you can get on a bike. If you don't want to be on a bike, there's so many different forms of just walking 1 mile to help with clarity, because that boosts your serotonin, your norepinephrine, your dopamines. You don't even have to know what that means to know that. If you just walk a mile, it's going to help it all.
Yeah,
I know. Yeah,
it's that simple.
I got help this weekend.
And also incorporating, my background is in holistic medicine. Mm-hmm. So incorporating things like with exercise, I'm always at the beginning of an intake asking a person, what's your diet like? Mm-hmm. Because we don't understand and recognize how much our diet plays into the role in the ways in which we move through the world.
Absolutely.
So in conjunction, and none of these things individually are going to solve the problem.
Right.
It's all in conjunction. So
Absolutely.
your diet, your exercise, your medication compliance, your talk therapy, all of those, the more tools that you have in your toolbox, the better off that you're able to manage your symptoms. And you are not your diagnosis. And right. I know we're coming to an end, but that's really what I want to
Absolutely.
Have people understand, that you are diagnosed with bipolar disorder. You are not bipolar.
Absolutely.
You may be diagnosed schizophrenic, but you are not. You have schizophrenia. You aren't schizophrenic.
Right. That is not your title.
Yeah.
And at the end of the day, it all comes with the mindset. Yeah. If you want to be able to change your outcome or change what you're perceived as, all you have to do is change your mindset. Mm-hmm. And once your mind is set, that's when you start to eat right. That's when you start to exercise. That's when you start being more compliant with your medication. So the SWAM challenge is really just creating a mindset that, hey, I need to change something. And once you do that, the world is yours once you start believing in yourself. And we can go deep into it because, and this is deep, because this table is not, we didn't know what this table was until someone told us it was a table. Mm. So you are what you believe. So if you believe that you are, that you work out every day and you can be a bodybuilder, and if you believe it, then you can achieve it. Mm-hmm. And it sounds lame, but it is so true.
The mind is our most powerful component.
It is the most. So once you start tapping into that, everything else falls into place.
So why don't you tell them where they can get in touch with you and how can they be involved in the SWAM Challenge?
So SWAM Challenge is really simple. I'm starting it as a nonprofit organization. What I'm going to start doing is going into schools, and it's going to be called a health day. That I do public speaking to educate the youth of how they, not how they should, or how they can empower themselves to be more strong-minded, and set small, tangible goals, and how that can empower them throughout life. So that is how our nonprofit is going to start.
And where are you doing this at?
So I'm in Fresno, California. Okay. But my goal is to start to move to LA and move to different places in California. Like I said, I'm in Utah. I have my best friend that has his organization out there where we'll start empowering kids out there as well. So
how can we find you?
So on Instagram, you can find me on swamchallenge.com, Facebook, Walter Watts, SWAM Challenge. And I think that's it. So Instagram and Facebook is swamchallenge.com. It's really that simple. And that's my website as well. So everything is SWAM Challenge. You can come follow me. And it's not just a movement, it's a lifestyle. So once you change your mindset, the world is yours.
What do you have going on, Miss Sarita, and where can the people find you?
So I am actually going to the Boris Lawrence Henson Foundation, which is Taraji P. Henson's foundation. She's holding a 2-day mental health challenge.
Yes.
Mental health challenge, Jesus. Mental health conference.
It's her first one.
Yeah, it's a first annual in DC, so I'm traveling and going to that, and she will be a keynote speaker, as well as Charlemagne the God, which has been doing some great work in mental wellness. So I'm doing that, and then continuing to build.
All right.
And people can find me at Sarita, SYREETAB, as in boy, MFT, on Instagram, and Sarita Butler, MFT, www.com.
All right. I will be diligently working with many of my clients and a couple more workshops, teaching them how to brand, why their logo is important, and hopefully getting them to use it on everything. So yeah, I just have a lot. It is hard, but we're going to work on it. So yeah, a lot of branding, PR stuff going on. You can always find me at sandandshores.com, Sand and Shores on Instagram, Sand and Shores on Twitter, and on Facebook. I'm pretty consistent.
Yeah.
It's branding.
Whatever.
Okay.
Oh,
You.
okay. Yeah, whatever. You guys can catch me in June at the Mid-City Art and Music Festival. Also, you can catch me on Facebook at Mahogany Box and Instagram, The Mahogany Box. And you can also support us, My Morning Coffee. We have new mugs, these right here. We have this kind. And we have this kind. They're available, $15.
And you can catch me on the beach with this one.
And I guess my car in this one with wine in it, because
Yeah, so we have new merchandise coming, so you guys